Hello, good evening.
Um,
My name is Folashade Onosoya. I'm a student family nurse practitioner. I want to be doing general physical examination on you today. So, what's your name?
Mayor Nasia,
What's the date of your birth?
April 12th, 1998.
Okay, so how old are you now?
I'm 20.
What's today's date?
Today's date is April the 20th,
Mm-hmm.
2018.
Okay. So, do you know what we're gonna do today again? Where are we now?
In the hospital.
Are we in the hospital?
Clinic.
Okay, so we are in the clinic. Okay, so what's the color of the clothes I wear now?
White.
What's the color of your clothes?
Red.
Red and
Black.
okay. So Miss Mary is alert and no rated testing. So first of all, I want to check your vital sign for physical examination. You've already weighed. What's your weight?
130.
Okay, so Miss Mary weight. What's your height?
9'5'4".
Okay. Good. Your blood pressure is 104/62. That's good with your age. Okay, let's see your pulse. Put your hand on it. And I might check your temperature. Under your tongue. Close. Should be under your tongue, not. Close your mouth together. Okay, the pulse is 70 and the SpO2, oxygen saturation, is 98%. And the temperature is 98.1. So everything is there within the normal range. Okay, now we'll start with the skin assessment. And I'm going to use my ruler. So, Miss Mary's skin, I'm going to look at the color. It's neat and the skin is intact, but I can see that it has some facial arcing. And for the hand, I saw that it has a birthmark. It's about 2 centimeter long and 1.5 centimeter in diameter. So, and it has some 1 point here, a birthmark too, in the same right hand. So, and our skin is the texture is warm to touch, and they are smooth, soft. So the abdominal skin, I'm checking for the sugar, is firm and intact. No loosening of elasticity. Can you turn to that side? Let me look at your back skin. Yeah, there's no edema, there's no lump, no mold, and the abdominal skin too is good. There's no hernia, so which is okay. Then for the leg, it has some scar due to the previous abrasion uh, and bruises. So, which is normal because uh, of her age. So, we finish from the skin. I'm going to check the nail. The nail is neat. The nail bell angle is, let me measure it. It's 160 degree. It's not, the normal one should be between 160 and 180 degree. So, which is okay. And it's intact. It's attached to the skin. There's no ingrown nail, and there's no discoloration, and the capillary refill is within the normal range, and it's pink. There's no thickness. Of course, Miss Mary is 20 years old, so in whole adult we see the couple of thickness, and there's no clubbing nail, and there's no blood, there's no bleeding, there's no discoloration, and the texture is not easily broke. It's firm and strong, and there's no brickle, and there's no hardness, too much uh, thickness. It's normal and smooth. So that's for the nail. So we are moving to your hair. Miss Mary hair is neat, and there's no lice infestation, there's no uh, dandruff, there's no lump. I'm palpating it, and there's no lesion, there's no mold, there's no surgical scar, there's no surgical operation on the hair, and everything looks good. There's no depression of the bone there. So the hair is well distributed. They are intact and strong, and it's not easily loose. So, and there's no alopecia. So that's for hair. So we're moving from the hair, we're going to the eyes. Miss Mary, can you stand up for me? You're going to read this. Can you, with one eye closed, don't press it too hard. Can you read the first line,
E
the second line,
L T
the last line,
F P H
the last line?
L T F P H.
Yeah. Okay, do the same thing. First,
E
second,
F T
and the last.
P O last.
Yeah.
L T F P H.
Okay, that's good. The visual acuity is intact. So now we are moving fast. So I'm going to check your pubic. The heights are symmetrical, bilaterally, they are equal, and I'm checking the pubic is equal to, look straight to the light. They accommodate the light by constriction, and they are equal bilaterally. So can you look up? Okay, the sclera is clear, There's no jaundice, there's no redness, there's no inflammation, and the conjunctiva is pink. There's no redness, there's no growth inside, and she's okay. And there's no. Do you have double vision? Okay. So Miss Mary can see good, and there is no jaundice. So that is what I'm looking for in the eyes, and Miss Mary can see properly. So we're moving from the eyes, we're moving to the nose. So the nose is lying between the eyes and well placed, and there's no deformity. So and I'm palpating it, there's no deformity, there's no growth in it, there's no hardness or obstruction. And I'm going to look into the nose. Can you look up? The nose inside, there's no discharge, there's no pulse, there's no swelling inside. So when I look at the eyes, I see the back of the eyes. There's no, the blood vessels is well lined, and there's no obstruction, there's no uh, cataract. We can see by looking at the opacity of the lens. The lens is okay. So now, I'm moving to the hair. The hair is well set bilaterally. Is not, they are symmetrical, and they are not low set like low Down syndrome patient. So now I'm going to palpate the hair bilaterally. They are okay. Warm to touch. So I'm going to use my horoscope to look at the tympanic and see what is there. Okay. Yeah, my light is on. So for the adult, I pull upward, backward. So the hair is painted, the tympanic membrane is intact, is gray in color. There is no sign of inflammation, there is no was, just a little bit in this here, which is normal. There's no obstruction with the was or with any growth. So let me clean this one before going to another one. So now again, upward, backward. So I'm looking at the tympanic membrane is intact. There's no breakage, and there is no swelling, there is no sign of inflammation. Everything looks good, and there is no obstruction. Okay, so we finish with the here. We're moving to the mouth. So I'm going to use my spatula and a touch. That's my spatula. Okay, so Miss Mary, can you open your mouth wide? I can see there's no missing teeth, there's no gingivitis, inflammation of the gum. The tongue, can you protrude your tongue? The tongue can move out easily. Can you smile for me? Can you frown? Can you blow your, and can you lift your tongue out? Okay. So now, can you swallow? Swallow reflex. Can you swallow again? Again? Okay, good. So now there's no difficulty in swallowing. So can you open your mouth again and say ha?
Ah.
Hold on. No, your tongue has to come out. You are doing it. You say ha, and I'm going to put this. I'm looking at the hard and soft palate. They are inside. There's no sign of inflammation. The tongue is pink. Again, say ha.
Ah.
So I'm looking at the tonsils and the glossy. They are inside. There's no sign of inflammation. That's the back of the throat. So I'm going to check the sign for. I'm going to palpate the neck for if there's any solid gland or inflammation of the lymph node. There's no inflammation of the lymph node, and I'm looking at the temporal uh, pulse is intact and they are strong and regular. So I can't palpate anything. Can you face this side? This side? This side again? So there's nothing to palpate. Can you look down? Look down. So sometimes some patients, the salivary gland and their lymph node in the neck is if there's any hair infection, then and the back of the hair too. Sometimes you feel some lymph node, but there's no lymph node enlargement, no gut gluteal enlargement. There's no lymph node enlargement. So everything looks good in the neck. So we're moving there now. I want to check the abdominal examination. Can you lie down, Miss Mary? So can you put your hand by the side? In abdominal examination, every examination you will start with inspection and palpation. But in abdominal examination, palpation is the last thing to do because of the bowel activity. Because when you palpate, you will not, you can't hear anything on auscultation. It can obstruct the assessment. So now I'm looking at Miss Mary abdomen. It's round. They are smooth. There's a little bit here distributed, and there is no hernia. There's no surgical operation, and there's no discoloration. There's no buddiness. There's no any issue, and there's no pulsation of the aortic aortic abdominal aorta. So now everything is okay through inspection. So with the inspection, I'm going to start with auscultation again. I'm going to start auscultating. I'm going to start from the low hypochondria for bowel sound, good bowel sound. There's no hyperactivity, and upper hypochondria, right, and low hypochondria. They are good, and I'm going to check for use the bell of my on my stethoscope to hear the aortic artery, abdominal aorta. Yeah, the pulse is good. Then the inner artery, good. Then I'm palpating for the femoral artery, checking for the femoral artery and the renal artery around this side. Everything looks good. So there's no injury. Everything abdominally is good. Then I'm going to do the percussion. I'm going to start with low hypochondria, and the normal Pacal sound is a tympanic sound. Any dull sound is sign of problem, indicates problem. But here you can hear the sound, tympanic, liver area, then the spleen, the kidney side, then moving to the bladder, then the intestine. So there's no dust sign and there's no, it's all tympanic sign, which is good sign. So I'm going to do the last one is palpation. So palpation now, I'm going to start with the light palpation with one finger about 1 centimeter deep. So start with rotate round, right hypochondria, move to the hyperchondria, round. There's no ballonment, there's no hard. There's nothing palpable. So now, Miss Mary, can you cough? Okay. I'm just checking for hernia, abdominal hernia, because some patients, when they have the abdominal hernia, by the time they cough, the hernia pop out. But in Miss Mary, there's nothing pump out. Everything looks good. And the skin is firm to the abdomen. So the last one is light palpation. That is the deep palpation. So sometimes we use two hands to palpate. You feel anything? I'm looking at Miss Mary if there's any discomfort.
Mm-hmm.
So there's no discomfort. She's so calm. How about the pelvic side? Because she's teenager, so I'm going to check for sign of PID. Do you see anything?
Mm-hmm.
Okay. So everything looks firm. So I'm going to be looking at the chest and the lung examination. I'm going to look at the lungs and the heart auscultation examination. So can you sit up, Miss Mary? So because she's a woman, I don't want to expose her in the camera, so but I will demonstrate how I can listen to the heart sound and the lung sound. You okay?
Yeah.
Do you want to use bathroom?
No.
You okay? So I'm starting to look for S1 is in second intercostal area. That's the S sound. This locked up. That's the normal heart sound. The second S2. Okay, that's good. It's very loud. Good. S3. Good. And good. So it starts from here. 1, 2, 3, 4. So, but it's more stronger here. There is no abnormal heart sound. There's no abnormal heart sound. Everything is locked up. It's not both like when there's a enlargement of the lungs. It doesn't sound like lump dump normal sound. but you hear something else like wolf, wolf, wolf. So I'm going to share for carotid artery too. So I want to listen to that with the bell of my uh, stethoscope. Okay. Some patients that have some heart problem, good, can hear from there. So, Miss Mary, can you turn and let me see your back? Yeah, with the back I can expose, and you can see. For the long stand, there's a upper, lower, and upper lobe around this place, and the lower lobes. So I'm going to share for the any whistling, any rokai, any ray. Can you take a deep breath again, again, again? Okay, again, again. Oh, okay. This is a normal long sand. There's no crack, there is no crackles, there's no rail, there's no rocky. So everything looks good to me. So um we now start with the neurological assessment. So we start from the head. So I'm going to check if your do you hear that?
Yes.
Do you hear that?
Yes.
Do you hear that?
Yes.
Okay, good. So when I move your hand, okay, let me use this spatula hammer. You don't restrict, just relax. Don't do anything. Relax your hand with me. So yeah, you need to relax. Your hand need to make some movement. Yeah, good. So again, relax. Your hand has to move. You need to relax. Relax every muscle to me. Yeah. So now your leg. So the legs, I'm going to see some movement. Okay. Just relax, Miss Mary. Don't restrict it. No, your leg's supposed to kick. Relax. Can you close your eyes and relax? Your leg's supposed to kick. Okay, good. Don't restrain it. Hang your leg. Just hang your leg and let it go. And this? No, you are restricting it. Let your hand gang and okay. Again? Okay, that one show a little bit. That's good. when when he touch you, I don't want to hit you so hard. Again, this one doesn't want to. Yeah. Okay. All right. So for another thing is, when I give you some object, you need to tell me what I give you. Can you close your eyes? Close your hand together. What do I give you?
A battery?
Okay. All right, Miss Mary. Sensory nerves is intact. So can you lie down again? So yeah, put your leg apart. So let me not cover the video. So I'm checking for, you see? Okay, okay, okay. So that's a normal sign, because but if it's uh uh fold towards me, that is abnormal. That, yeah. So that's good. So the last one is this one. Supposed to jack too. Yeah, that's done. So other one too. Relax your leg. Okay. So now, when I'm pushing towards your leg, can you raise your leg? When I'm pushing down, don't let me. The resistance. Okay, good. Put that one down. When I'm pushing down, don't let me. Good job. Then your hand too. Raise them up. When I'm pushing down, don't let me. Okay. When I'm pushing down, don't let me. Close your eyes. You can see. Stand up. Close your eyes. When I'm pushing down, don't let me. When I'm pushing down, don't let me. Okay. So that's a good. Can you widen your hand? So when I'm closing together, don't let me. Don't let me. Good. 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 So can you walk to that side? I'm checking for the gate. Normally it's supposed to walk about 20 feet for third uh, examination. Okay. So can you walk with the heel of your leg? Can you walk with the head, the toes? Walk with the toes again. Okay, let's do the balancing now. Can you stay still? Then close your eyes. You don't let me when I do your hand. Some patient with this, they don't stretch your hand. Yeah, and close your eyes. They cannot stand this for some minutes, because when they stand, some of them fall. That's for the balancing. They cannot do it. So especially some patient at risk for fall. So Miss Mary can stand it and he can do it. All right. So Miss Mary, thank you. Um, do you have any questions, Sida?
No.
You don't have any question?
No.
Um, I believe everything is done. Thank you for assisting me in my schoolwork, and thank you again.